in 5, 4, 3.
Good afternoon. I am Sandy Garrison. I'm the Chief of Human Services and Community Support. I would like to welcome everybody who is here present and virtually to the Delaware County's needs-based public hearing. This is where we talk about the plans for the upcoming fiscal year, as well as the fiscal year ending in June 30 of 2024, to discuss what we would like to do as a county with our child welfare allocation. I just need to mention, new to the group this year is our juvenile detention. Typically that had been under court services, but is now as a separate entity under the county, and the Juvenile Detention Board is represented separately at this meeting. So with that, I will turn it over to Vanessa Pierre, who is our Children and Youth Administrator.
Good evening and welcome, everyone. I'm Vanessa Pierre. I'm the Agency Administrator for Delaware County Children and Youth Services. I'd like to introduce our planning team, which is Beth Pradell, the Deputy Administrator, Dorothy Stewart, Director of Policy Planning and QA, Dave Scotty, Quality Assurance Administrator, and for the Office of Juvenile Probation, I'd like to introduce Danielle DiMatteo, the Director, Jeremy DeMia, Deputy Director, Dan Burke, Fiscal Consultant, Phil Gerace, Supervisor to the Administrative Services, Kirsten Fitzsimmons, Resource Supervisor, and for the Juvenile Justice Center, David Izari, Superintendent, and Kirshna Hilliard, Deputy Director. For any comments you may have, please email any questions to delco_NBPB@delcohsa.org. The purpose of the meeting is to gain public input on the proposed needs-based budget plan for Children and Youth Services, the Office of Juvenile Probation Services, and Juvenile Justice Services for the fiscal year 23-24. But first, we'll review the budget and implementation plan for 22-23.
So, my name is Dorothy Stewart. I'm sorry. I'm Dorothy Stewart, the Director of Policy Planning and Quality Assurance for Children and Youth Services. When we do our needs-based plan and budget, we make sure that we get input from our stakeholders. So this year we did focus groups with families receiving services from the agency. We also consulted with the Dependency Juvenile Court and the Children's Roundtable. We talked to our in-home, our placement, and our family engagement providers. We talked to our guardians ad litem and our county solicitors, as well as talking and doing focus groups with our staff and with our administrative team. So our budget for fiscal year 22-23, we received our tentative allocation as recommended by the Pennsylvania Department of Human Services, Office of Children, Youth and Families, and our tentative budget allocation is $50,050,676. In addition to that, we are approved for $7,628,267 for our child welfare special grants. Now, our grants include our independent living grant, our housing grant, our truancy grant, and grants for several evidence-based programs. For our needs-based budget request, which would be our allocation for 23-24, we're requesting $63,292,500, which is an increase of approximately $4.7 million or 8% from our 22-23 implementation year budget. And a significant portion of that increase would be attributed to salary and benefit costs, as well as new and revised regulatory requirements, including the Family First Prevention Services Act. Our budget is a mix of state funds, which is about 64%, federal funds, about 14% of our budget, county funds, about 21% of our budget, and then 1% from other sources. In addition to our needs-based budget allocation request, we are also going to be requesting approximately $7,400,000 for our special grants for fiscal year 23-24.
My name is Beth Pradell, and I'm the Deputy Administrator. Children and Youth Services, we've completed over 3,000 investigations
Children and youth, we've completed over 3,000 investigations of child abuse and neglect during this past fiscal year. Ongoing services have been provided to over 700 families, and that includes services to families who may have children in the home or children who are in placement. After a decrease in childline reports during the pandemic, the childline reports at this point of abuse and neglect are approaching pre-pandemic levels at this time. Children and Youth Services strengths. We've continued to utilize family engagement services. These services include family group decision-making, crisis rapid response meetings, youth transition conferences, and family finding. With these services, we pull together and utilize the strengths of the extended family to support the families and the children who are in crisis. Strong family engagement services have resulted in a decreased number of children requiring out-of-home placements. Children and Youth Services is participating in a new initiative. It's called the Multi-Systems Integration Pilot, and this is spearheaded by the Office of Juvenile Probation. This pilot will help systems, including the mental health system, education, the courts, CYS, and JPO, to address the complex needs of the multi-systems youth that are involved with each of the systems. Children and Youth Services also contracts with Children's Choice, which is a provider that provides community-based visitation for children and families when children are out of the home. During this past fiscal year, we opened up another home, and this provider, what they offer is a home. It's called Grandma's House, and so the children go to the home and visit their parents at Grandma's house. And it's a fully functioning home. It has a kitchen, it has a place for the children to do their homework, and it's just a more natural setting for the children to visit their parents. Children and Youth Services is working closely with a county provider to open an emergency youth shelter in Delaware County. It's anticipated that the shelter will open by the end of fall this year, and this shelter will accommodate approximately 26 youth, and it will service both boys and girls and is located in Chester, Pennsylvania. Children and Youth Services is an active participant in the statewide initiative to develop new statewide case management system for child welfare. So it's a new system that will eventually be in place in a couple of years, and we're very involved in the development of that along with other counties. And Children and Youth, we received funds from the Consolidated Appropriations Act, and these funds were used to help older youth transition from agency custody, and it would help them with the cost of housing, transportation assistance, and any necessities that they have while they get into their own home and start on their own. So our challenges: we continue to struggle with recruiting and retaining staff. At this point, there's a 38% vacancy rate for our casework staff. And of our social work positions that are filled, 48% of the staff, 48% of those staff have been with us for just less than 2 years. There is a 66% rate of our social service aid positions that are vacant, and a 54% of clerical positions that are vacant. This creates a very, very big challenge for all of our staff every day to manage their caseloads and the responsibilities that they have. Opiate abuse. It continues to be a serious concern in the county. Since 2020, Children and Youth has received reports of 9 near fatalities of children and infants as a result of ingesting fentanyl. The agency has contracted with a provider called Maternity Care Coalition, and they complete what's called safe plans of care. It's required under CAPTA, and it's required for all infants who are born affected by substances. So if a doctor has determined that that infant has been affected by any sort of substance, then what's called a safe plan of care is offered to the family to be developed in order to support that family as the infant goes home. It can be offered up until the age of 2 years old for the family. And it is voluntary, so the safe plan of care is not something that is required for the family to do. It is voluntary. Children and Youth Services will also have certified recovery specialists in each site. The certified recovery specialists will be able to provide peer-to-peer support for parents struggling with addiction to move into and through the recovery process. So these are individuals who also have suffered through an experience of addiction and can work with our parents one-on-one and help them through that process and any challenges that may come up along the way. Children and Youth Services has had a significant increase in referrals for multi-system youth with serious mental health and behavioral concerns. When children are recommended for medically necessary residential treatment for mental health, there are very, very long waiting lists for beds, if there is a placement facility willing to accept the child. So if we have a child that has these very serious mental health issues, it's very difficult for us to even find a facility that has a bed open or that would be willing to accept some of these youth based upon their mental health issues. Child welfare dependency placements are unwilling and unable to accept youth who have histories of assaultive behavior. So many of our youth, unfortunately, do have a history of some sort of assaultive behavior, and our placement facilities are for dependent youth, and many of the placement facilities are reluctant to take in children or youth who do have that history of assaulting other children or others in the community. So there are long waiting lists for outpatient mental health services. For the children that are in the home and we've not been able to find a placement for, there are mental health services, but unfortunately, there's a long waiting list for them. We've been working closely with the Pennsylvania Office of Children, Youth, and Families to address the needs of these youth. So in situations where we have youth that it's very difficult to find a placement for them or to access services, we will work with our State Office of Children, Youth, and Families, and we have what's called a complex case review. And it brings in all of the systems and individuals at higher levels to talk about the case in an effort to create a plan.
Okay. So I'm going to talk about our budgetary priorities for fiscal year 22-23 and fiscal year 23-24. So we remain focused on our successful implementation of the Family First Prevention Services Act. The Family First Prevention Services Act is federal legislation which really uses, it's really focused on making federal fiscal funds more accessible if we're going to use evidence-based practices. It also focuses on decreasing the use of congregate care for youth. So we have been working diligently. We've done requests for proposals for 2 new evidence-based programs, intensive family coaching, and Triple P is a parenting program. So intensive family coaching is based on parent-child interaction therapy, and it's really an evidence-based treatment for younger children who have significant behavioral issues to try to support their parents in caring for them. And Triple P is an evidence-based parenting program that reduces the risk of child abuse and neglect in vulnerable families. We're also going to be releasing an RFP for Nurturing Parents, which is an evidence-based program with a focus on parenting groups and services for fathers. They also do a group and they work closely with families struggling with substance abuse on parenting their children. So in alignment with the Family First Act, we are continuing to prioritize decreasing our use of congregate care. So we're continuing to do increased outreach to kin when we're planning for vulnerable children, and I know that this is a priority for our court system and for the Children's Roundtable. We're also working closely with local placement providers, trying to work with them to develop recruitment strategies to have more resource parents that will work with older youth and that reside within Delaware County. We remain focused also on our continuous quality improvement. So in 2019, Delaware County participated in a quality services review, And at that time, we identified improving outcomes for our older and transitioning youth to ensure that there is identified and workable plan for their education, their housing, their income, their medical needs, and their life connections. So we have youth transition conferences. Every youth in care has a youth transition conference with supportive professionals and family members and community members attending to support them and help them develop a plan. We also are focused on improving our assessment tools and strategies so our caseworkers can better understand a family's current situation, their environment, and their supports. So right now, the state is looking at a universal assessment tool, and they're piloting that. The universal assessment tool is called the FAST, or the Family Advocacy and Support Tool. The Quality Assurance Department at CYS has been involved in training and testing that tool, and working with the state closely as we get ready to move into this universal assessment process. So, thank you. So we'll turn it over to JPO.
Good evening again, Danielle DiMatteo, the Director of Juvenile Court and Probation Services. I'm going to talk a little bit about juvenile court and probation services, but when we talk about juvenile justice generally, we have to remember that Pennsylvania's mission is balance and restorative justice. And the barge principles, as you'll see on the PowerPoint presentation, I'm not going to go into detail, but youth redemption, victim restoration, community protection. So that's the mission in which we operate here in Delaware County as well, except for we operate under the authority of the president judge. And we comply with various statutory requirements, including the Juvenile Act, the rules of juvenile court procedure. I'm going to wait for the slides to catch up here. The Juvenile Act, the Pennsylvania Supreme Court Rules of Juvenile Court Procedure. Some of those rules define our role as probation officers under the court. Additionally, you'll find our mission statement in the handout. Most importantly is that our portion of this budget and plan is service-driven, directly for services that the youth and families receive. So it does not support our general operation or the cost of staffing and other services within the direct department. I'm going to turn it over to Kirsten. She's going to talk a little bit about our statistics currently coming out of 2021.
Good evening. My name is Kirsten Fitzsimmons. I'm the Resource Supervisor for Delaware County and Juvenile Probation. So in 2021, our delinquency allegations are actually down about 50% lower than they were during the last pre-pandemic year, which was in 2019. So back in 2019, there were about 1,000 allegations of delinquency, and currently in 2021, we only had about 558. And regarding those, sometimes delinquency allegations end up as juveniles who end up in placement, but the rate of placement in 2019 was about 4%, and we're about 50% lower than our last pre-pandemic year at 2% currently. And when recommending placements, there are a multitude of alternatives that have already been considered and or tried in the community. And of those youth who are deemed to be in need of placement, it's an overall small percentage of the youth served as a whole with the department. And these youth are often the ones with the most complex needs and maybe multi-system involved with CYS as well. So back in 2010, Pennsylvania implemented the Juvenile Justice System of Enhancement strategies. This is the monograph, which represents various stages of strategy that they are trying to implement. As we go through it, we often circle back to the beginning to ensure proficiency and fidelity among our staff and our providers. In the beginning, we focused a lot on delinquency prevention and diversion from the system. But as you move through the stages, we continually try to focus on family involvement with the youth, data-driven decision-making, training and technical assistance, and then continuous quality improvement, which is done through the SPET process. We're constantly evaluating our providers for fidelity and making sure that they're adhering to evidence-based practices, reassessing them, coming up with performance improvement plans so that their practices align with what the state is trying to do. Some of those that we currently use are the YLS, which is the Youth Level of Service, which is an assessment tool that we use to determine how often we should be meeting with youth, what are the criminogenic need that we should be focusing on with the youth, motivational interviewing with our clients so that, we're getting them thinking about their decisions as they're talking to our juvenile probation officers as well. Case planning, which can include family involvement, evidence-based skill building and tools, the 4 core competency trainings, evidence-based programming, including ART, which is aggression replacement training or therapy, which focuses on anger management and how for youth to work on their anger issues in the community. T4C, which is thinking for a change, MST, which is multi-system therapy. We have evidence-based language and service contracts so that the contract providers that we do use must be using evidence-based programming. Quality assurance measures, we do facility reviews, we do staff reviews, trauma-informed training and active interdepartmental work groups, which are active with the county and the state, and evaluation of service providers using the SPET program, which is Standardized Program Evaluation Protocol, which has been nationally recognized.
Good afternoon. I'm Dan Burke, Fiscal Officer for Juvenile Probation. I'm going to discuss Juvenile Probation's recent out-of-home placement and detention admission trends, along with Juvenile Probation's accomplishments in fiscal year 21-22, as well as the challenges and priorities facing probation moving forward into fiscal year 22-23. As you can see, out-of-home placements have steadily decreased every year since fiscal year 12-13. These declines were pretty steady each year until the onset of COVID-19 pandemic, when placements took an even sharper dive, dropping by more than 50% in 1 year and continuing this steep decline in the past year as well. The steady decline in placement admissions can be strongly attributed to probation's efforts to utilize the least restrictive setting possible for all delinquent juveniles, as these continued efforts have resulted in placement decreases for many years now. However, with the onset of the COVID-19 pandemic and the closure of the Delaware County Juvenile Detention Center, placements saw an even more significant decrease. Probation has also experienced a steep decline in detention admissions to coincide with the decline in placement admissions over the last 10 years. As you can see, the decline in detention admissions has been significant every year for the last 10 years. However, in the past 2 years, the decline has been aided by the closure of the Delaware County Juvenile Detention Center. The detention center closed in March of 2021, at which time probation was only able to utilize other counties' detention centers and private detention providers, which both had very limited bed space available. Probation quickly contracted with any and all detention providers we could, but detention beds remained difficult to come by, which reflected an extremely low detention admission seen since March of 2021, with only 80 detention admissions in the entirety of fiscal year 21-22. As discussed in the previous slides, probation saw a 52% decrease in juveniles admitted to out-of-home placements in the last fiscal year, which was a significant accomplishment as probation continues to focus on utilizing the least restrictive setting possible for all delinquent juveniles, emphasizing the use of in-home services in any cases where it's deemed beneficial to the juvenile and safe for the community. Probation also contracted with a handful of new vendors to provide supplemental detention services in the wake of the closure of the detention center in March of 2021. Probation contracted with other counties and private providers to secure any possible available detention beds. Though even with these new detention services, detention beds are extremely difficult to secure. Probation also saw a decrease in recidivism rates for juveniles within 1 year of discharge from out-of-home placements in fiscal year 21-22, as the number of juveniles replaced in 1 year of discharge from placement dropped to its lowest amount on record, with only about 11.5% of juveniles being replaced within 1 year of discharge from out-of-home placements. In addition, probation also expanded placement resources throughout the state by contracting with an array of additional placement providers in fiscal year 21-22. However, placement options remain very limited, and finding appropriate out-of-home placements for our most difficult youth remains a challenge. One of the major challenges facing Delaware County Juvenile Probation going into fiscal year 22-23 will continue to be the lack of local detention. While only approximately 2% of youth entering the juvenile justice system require secure detention, not having a local detention option makes serving these youth extremely difficult. Without a local detention option, probation has to rely on supplemental secure detention facilities through other counties and private providers. The lack of detention options has also led to an increase in the number of youth receiving GPS monitoring services as the youth are awaiting residential services. Another challenge facing juvenile probation is the current lack of available mental health services, drug and alcohol services, and specialized residential placement settings. There are currently long waiting lists for all of these types of services, and as a result, there's very limited options available currently. In addition, probation has experienced an increase in the number of juveniles being denied admission into these programs due to the complexity of their cases. Finally, keeping the recidivism rate at an all-time low is also at the all-time low probation is currently experiences is also going to be a significant challenge in fiscal year 22-23. Keeping recidivism rates at this low a number will be extremely difficult, considering the fact that the majority of juveniles currently being placed in out-of-home services are more challenging cases, which historically are more likely to result in the juvenile being replaced or rearrested upon discharge from placement. Some top priorities for juvenile probation as we move forward into fiscal year 22-23 are to emphasize strategic planning using the PA JCJC JJSES plan, as Kirsten detailed earlier, and state and local initiatives. Another priority is to increase collaboration with PA OCYF to ensure adequate funding. This, of course, is one of the main goals of the needs-based process. Another is to enhance multi-system collaboration. We used the Georgetown University and Stone Lay project. In addition, we would try to reduce the days of care for juveniles in secure detention. While the admissions were very low for juveniles entering detention, the days of care still remain relatively high, as the juveniles that do enter detention are the most difficult cases. And with the lack of residential facilities to house these juveniles, a lot of times there's a long wait for juveniles to find a bed spot. And I'll hand this over to Dave from Detention.
Thank you, Director DiMatteo and Juvenile Probation Office. Again, my name is Dave Rosari on behalf of the county's Juvenile Detention Center. As we all know, and as our partners at probation stated, the center remained closed the entirety of FY21 and 22. Moving into FY22 and 23, it's the full intent of our department to apply and reobtain a secure facility license, which elapsed in August of 2021. Additional priorities for FY23 are to execute renovations to the existing center. We want to ensure that it's a more trauma-informed center for youth who need to reside there. We hope to recruit, train our staff, as well as we want to continue to collaborate with Children and Youth Services as well as the Juvenile Probation Office and other relevant criminal justice stakeholders to explore and potentially invest in evidence-based, culturally responsive, community and detention-based services to improve the outcomes of young people here in the county. Moving on to FY24. Again, it's our department intent to be fully staffed and operational as it relates to a local facility. Our department will continue to collaboratively work with all relevant stakeholders to continually analyze data and identify the needs of its population. Next slide, please. So, although we are a new partner at the table, I consider us small but mighty. When we look at the strengths of our department, our local our county council created an oversight board known as the Juvenile Detention Board of Managers. It is a small but a diverse and skilled group that is leading this process. They've also brought on new leadership, myself as well as 2 other directors. We look at this as a current strength as we build toward the future. We look at our challenges, and our partners at probation just stated, there is a crisis across the state in terms of detention beds with the lack of alternatives. As we build our local center, it remains to be a challenge. In closing, I would say our department is committed to collaborating with probation as well as Children and Youth Services and all the other stakeholders to inform our decisions about best services and needs as it relates to resources to determine what our young people need. And we have a specialized intent to make sure that we're targeting young people who are authorized by the court for detention services here. And I'll turn it back over to our Chief DiMatteo.
Good evening again. So we want to thank you all for coming, for joining us. For additional questions, you should. Sorry about that. So we just want to thank you again for joining us in person and virtually. For any additional questions, you can contact Children and Youth Services by emailing Vanessa Pierre at pierrev@delcohsa.org. For Juvenile Court and Probation Services, you can email me directly at dmatteo@co.delaware.pa.us. And for juvenile detention, Dave Irizarry at irizarryd@co.delaware.pa.us. We'll turn it over to the members who are here in person or virtually if there are questions.
And I'd just like to make one final closing comment. I'm sorry, this is kind of off script, but just to thank the staff. I know you heard Ms. Stewart talk about the vacancy at Children and Youth Services. I know Juvenile Court has probably a vacancy as well, and just the enormous effort that our staff put in on a daily basis to cover all the voids. They're not being covered because we're 38% down in employees. So I just want to thank everybody in Children, Youth, and Juvenile Court, and obviously Juvenile Detention, for all the work they do on a daily basis. And I just want to thank our County Council for the support of Human Services, including Children and Youth. A couple comments with respect to the lack of mental health services and drug and alcohol services. I'm sure everyone's aware of the situation with Prospect Crozier. The county is diligently working on alternative programming. We also are working with our new behavioral health managed care company, which is Community Care Behavioral Health, in hopes that we can get more services in the area. We do realize that this is a huge need in our county. We also are working closely with various stakeholders, including the new detention office, to talk about the no wrong door and making sure that there's caseworkers that are versed in all services offered through Human Services. So if a child enters, no matter what door they come in, they get the services they need. So thank you.